Today's topic is dislocated shoulder. A dislocated shoulder is an injury that occurs when the round ball at the top of the upper arm bone pops out of the cup-shaped socket that's part of the shoulder blade. Unlike a lot of joints in the body, the shoulder is incredibly mobile, which makes it susceptible to dislocation. This mobility also allows the arm to move in different directions. The shoulder joints are the most commonly dislocated joints in the body. Dislocating the arm in many directions is possible. A dislocated shoulder is described by the location where the upper arm bone ends up after it has been dislocated. A dislocated shoulder is more common in males than in females, and it is more common in teens than in younger children. The dislocation can be anterior or posterior. Anterior describes where the upper arm bone has moved to a position in front of the joint. About 95% of shoulder dislocation is anterior. Posterior describes where the upper arm bone has moved back towards the shoulder blade. The ligaments, tendons, and muscles that reinforce the shoulder joint may tear as a result of the dislocation. This is one of the complications associated with a dislocated shoulder. Other complications may include damage of the blood vessels in and around your shoulder joint. Causes: shoulder dislocation is caused by any forceful impact or injury to the shoulder joints. Trauma, such as motor vehicle accidents, sports injuries, and falls can cause the shoulder to be dislocated. While in younger people, dislocation tends to arise from trauma and are often associated with sports such as football, rock climbing, skiing, rugby, volleyball, and basketball. In older people, dislocation can be due to the gradual weakening of the ligaments and cartilage that supports the shoulder. Symptoms: intense pain, swelling or bruising, inability to move the joints, a deformed shoulder, muscle spasm, numbness or tingling near the injury, such as in the neck or down the arm. Diagnosis and treatment. Diagnosis is based clinically on shoulder appearance. The doctor may carry out a physical examination to check for tenderness, swelling, and deformity. Pulse and sensation are also evaluated because blood vessels and nerves can become damaged when the shoulder becomes dislocated. Imaging tests such as X-ray, MRI, and CT scans can be used to determine the extent of your injury. Treatment. Treatment option may include closed reduction, where the doctor will try to push your shoulder bones back into their proper position. Depending on the severity of your pain and swelling, the doctor may give you a mild sedative or muscle relaxant to help relieve your discomfort. An X-ray may be used to confirm if your bones are back in position. Immobilization to keep your shoulder from moving as it heals. To do this, the doctor will use a sling or splint to support your shoulder. Your doctor may also recommend medications such as ibuprofen or acetaminophen to relieve pain as your shoulder heals. Ice can also be used to reduce pain and swelling. In cases where complications are present, surgery may be needed. After your shoulder splint and sling are removed, you may begin a rehabilitation program to help you regain your strength and improve your range of motion. The type and duration of your rehab program will be based on the extent of your injury. Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.